what do you think the cause of it? And do you think that the neurotypical children should also be opting for occupational therapists, to find the treatment of their handwriting issues? Because we often say that the mainstream school teachers or the parents of the neurotypical children don't usually consider therapy as an option. They just think that it's going to improve with the time. So, do you think that if a neurotypical children is facing some handwriting issues, he should also be, looking for a therapist?
Yeah, I think they can benefit from occupational therapy. Um, so, one thing that I do in the setting I am in is what's called response to intervention. And so, for a particular child that is having issues with handwriting, I won't necessarily put them on caseload, but I would meet with the teacher, I would meet with the parents, and start to kind of give them pointers on what to do. I may come into the classroom and observe, and at the same time, I'm discussing with the teacher on what this particular child could be doing. But looking at the overall span of neurotypical children, I think many can benefit from occupational therapy. And when we as occupational therapists merely focus on our special needs population, I think we are painting ourselves into a corner. And so the only people that gets to know us and gets to know our profession and how terrific that we really are is, those people in special needs, which is not a large part of the population. And so to actually grow the profession, I think it is essential to work with neurotypical populations. And we can push ourselves into, like you were saying, we can push ourselves into classrooms to help teachers work with kids with decreased executive functioning skills that may not actually qualify for occupational therapy. Looking at these kids again, we can focus on, like you were saying, handwriting, or even with kids that have deficits reading in classroom. It might not be a cognitive issue. It could be a visual perceptual issue that may not allow them to actually qualify for occupational therapy in the school setting, but we could intervene and provide support to that particular child. And expanding upon this, we can look at other settings as well when we look at neurotypical the neurotypical population. We can look at the elderly population that wants to stay in their home and not be required to, say, live with a family member or go to a geriatric facility to live out the rest of their days. We can go into their home and we can adjust it. We can make it safer. We can make things easier for them to accomplish, like cooking, simple things like moving the pots and plates to a certain place. There's simple things that only an occupational therapist would think of to make this person life simpler, or even just looking at energy conservation. There's so many ways we can input. And if you want to take this a little bit further, we can look at the workplace. When we go into offices, with our OTIs, we can see a lot of things wrong. We can see the chair height isn't wrong. We can see that the keyboard isn't placed in the right place. We can see that the monitor is too low or the monitor is too high. And these things we can present ourselves, and we can better the environment. And for the neurotypical population as a whole, I look at it as avoiding a larger problem by taking care of the small problems that exist now. Because what I've run into is, let's say there's a first grader that is having some difficulties with handwriting. They're getting by and they're doing okay. but their handwriting's a little bit slow, but they're keeping up with their peers. So they're not referred to occupational therapy, but the teacher does realize that that particular child is slow. Now, let's move forward a couple of years. Now, this child is in fifth grade. Now, still writing the same way, and their handwriting production is still slower, but their classmates now in the fifth grade are writing much faster. And now, this fifth grader is seen as having writing difficulties and is now referred to occupational therapy. Whereas if you would have given us the quote unquote neurotypical child when they're in the first grade, we could have alleviated that problem. And now trying to fix let's say, a 12-year-old's handwriting as opposed to a 6-year-old handwriting is completely different. And so working with that neurotypical population is beneficial in the long run and can help us avoid making these smaller problems into huge problems later on in their lives.
Well, that's very well. Thank you so much for the detailed answer. And I think two of the most important points are, like you said, that it's not always necessary the child is having the fine motor handwriting issues. It could be the visual perception as well. So let's the occupational therapist, look into the matter. And again, a very important point, don't waste the time. Go to the therapist earlier. Okay, so now I want to talk about, one of the most common problem faced by the parents of children with ASD, autism spectrum disorder, and that might be is the stimming. And maybe this is one problem for which they want occupational therapy the most. I know it is difficult from them if the child is rocking all the time or anytime, or he's jumping all the time, or using that kind of stuff. Now, what I want to ask you is that should the parents be stopping this kind of behavior? To what extent they should be trying to resist this kind of behavior, and what else can they do, and what else can the therapist do, to particularly to avoid the stimming, because the triggers varies. The triggers could be anything, and the parents sometimes lose their cool on this particular behavior. So how would you guide therapists and parents about the stimming behavior?
First of all, I would want the parents to understand what stimming is, and I try to put it as basic as I can. So the way I like to describe it to parents is if they were itching, they would scratch. You're not going to have an itch on your arm or somewhere and not going to scratch. And I try to use that to relate to how this child is feeling. Um, and so I think that kind of bridges the gap of of understanding. And every time they see their child stimming, they'll refer back to, well, Dr. Covington explained it as an itch. And if I was itching, I wouldn't just not scratch and relieve that itch. So I explain it in that way. And also, when you look at stimming, you have to look at that particular client's culture as well, because stemming for culture A that think that has the mindset that, well, you should be, let's say, quiet in public and not be loud, as opposed to culture B, who is very boisterous and very excessively social. They're going to interpret that stemming in different ways. So with that, you have to adjust to that particular family and not just look at the client that is stemming. If I had to give it, when I want to give advice to clients that are, very worried about their child stemming and perhaps the perception of it, what I like to do is try to find if there's a trigger, like you were saying. Um, we'll try to avoid that trigger, and if it's something, if the trigger is internal, and let's say you have a child that when they're stimming, they're rocking, and so that rocking may be giving them a vestibular sensation when they're rocking back and forth. So if we can substitute that that stimming or that rocking and give them something else that gives them that sensory satisfaction that rocking does, I think that helps a lot because that intervention that the parent may provide may be more preferred than the particular stimming action. I've used things like brain entrainment to provide sensory stimulation. I've used virtual reality, say prior to a child going into a particular environment that we knew would cause the person to stim. So I've used a number of things that I've found helpful and that parents also find helpful and more preferential.
All right, great. Okay, so we have a question from Mubashra Hamzi, and she's asking what we should do to deal with serious depression that is caused by thinking about wrong decisions of past or missing good opportunities. So, can an occupational therapist help there?
Okay, the question is, let's see, what should we do to deal with serious depression that is caused by thinking about wrong? So this is about let me just clarify the question. Is this the parent thinking this or the parent having the depression? I'm trying to clarify the question.
All right, so I hope that she's listening to the live stream, so she must clarify the depression. Okay, so she's talking about one adult with the depression. Okay, so here we can say the client or the patient is that adult with the depression, and she's asking that can an occupational therapist help there?
In regards to depression, there's various ways occupational therapists can participate. One, which is sometimes difficult to do, we can look at the root cause of the depression. Was the depression brought on by a loss of a family member? Was the depression brought on by failing at something? So what I would do is try to base my therapeutic intervention around that loss and the acceptance of that loss. And also allow them to understand that there are more opportunities out there for them to succeed or to participate. There's also the medical route where sometimes clients may need to be referred to a psychologist or psychiatrist or a medical doctor to be prescribed certain medications. That's not my first choice, but I would not leave that option off of the table.
Okay, so do you recommend a sensory therapy for the adults? And do you think it is good, the sensory therapy is a good option for, the psychiatric patients, the depression and anxiety? Could this be an option?
Could you repeat that? You were breaking up. I'm sorry. Could you repeat that one more time?
All right. So I was talking about, the sensory therapy, the sensory intervention, which we
Mm-hmm.
mainly do with people with sensory processing disorder and ASD.
Mm-hmm.
Could the sensory intervention be used with the